Again, I want to welcome all our viewers to Nakuru County, county number 32. We're at the Sarova Woodlands Spa and Hotel. Now, in a little over 2 hours after midnight, the world will be marking the 2021 World AIDS Day, at least in Kenya, in regards to our time zone. And tonight, we want to have a very important conversation. 40 years on, where is Kenya in regards to fighting HIV? What gains have been made, but also what are the challenges? Some very worrying statistics for you this evening. First of all, we are told that 54% of sexual violence is witnessed in girls aged 10 to 17. Those are 2021 statistics. The highest numbers are in some of our cosmopolitan areas, Nairobi, Nakuru, Kisumu, and Uasin Gishu, but also teen pregnancies. And I really want us to focus on that this evening as well. Some of the statistics that we have: 398,840 reported teen pregnancies. That was last year. And this year, so far, in terms of the numbers that we have, 274,510. Now, I know some of you might be thinking there's been a decline. That's great news. But stakeholders out there are saying it's not enough. More needs to be done to tackle this pandemic of teen pregnancies and, of course, ensure that we reduce new HIV infections by 2030, which is the vision. Now, we've got a most competent team of panelists, both here with me on stage and in the audience, that I want to let you know a bit about. And also that you can weigh in on this conversation. I'll be reading a lot of your feedback. 22422 is the SMS line, and the hashtag this evening is NEWSNIGHT. But there's another hashtag that's in regards to tomorrow. I'll be telling you about that as we continue. Let me introduce my guests who have joined us on the program this evening. I'll start from my far left there. We have Dr. Kariuki Gishuki, who's the CEC Health, Nakuru County. Daktari, thanks for making time for us this evening. Next to him, we have Reverend Mulinge Mutuse, who's joining us as well. He's the ambassador of an institution of religious leaders who are engaged with helping fight against HIV. He'll be telling us about his institution, the work they do, and his personal experience as well. Pastor, thanks for making time for us today. Next to me, we're talking about teenage pregnancies, and there's a lady with a story here, Viona Juma, teen mother living with HIV, and she'll be telling us her story as well. Viona, thank you for making time for us. In the audience, we also have Dr. Ruth Marshall. She's the CEO of the National AIDS Control Council, and I'll be getting to hear from her as we continue this conversation. Remember, we are doing this in partnership with the National AIDS Council, just a few hours to the World AIDS Day. We are also joined by Maureen Murenga. I want to acknowledge her presence here, Executive Director, Lean On Me, and she'll be talking about the work her institution does, and Davis Juguna from Netel. We've got all the right stakeholders in the room right now for a very important conversation that I want to delve into at this moment. Viona, let me actually start with you on this one. Thank you so much for making time for us this evening. You have quite a story. Na ningependa uanze kwanza kwa kutuambia yale umepitia upande wa maisha yako.
Okay, maisha yangu mimi nimezaliwa Bungoma, but my parents walikufa kama bado niko mdogo. Actually nimekuwa orphan, nimeishi na shosh, but shosh na yeye hajiwezi. Sasa nikapata early pregnancy while I'm 17. Sasa kupata ule mtu mwenye alinipea bola akani abandon. Nikabaki hivyo, then nikapata guy akachip in akasema atanisaidia, so ile time ananisaidia kidogo hivi akakufa. Nikabaki alone. Kisha nikajaribu nikauza sukuma, nikajaribu everything kuuza mahindi, but si ku manage. Ndo hapo ndo nilijengeza kwa sexual worker. So hiyo sexual worker ni hard, ndio ulipi ushuru, ulipi anything, but it's hard. Unapata maybe a guy anakutumia but haizi kulipa, anakuambia ukimuuliza uwezi mshtaki, anakuambia yeye ashaenda, yeye ameshamaliza, na kuachanisha hapo hivyo. Alafu nikakuja nikajikuta niko na HIV, whereby hata sijui nilipataje, juu kuna wengine ukimwambia tumia na kuambia ana spend. Sasa life yangu imekuwa difficult, ndio sikutaka kwangu niko hivyo, juu lazima niko na shosh na niko na mtoto, mimi ndio baba, mimi ndio mama, mimi ndio kulipa nyumba. Hata nikikuja Nairobi kuna mama mwenye aliniita nifanyishe kazi ya nyumba, analipa 3000. That 3000 inafaa nilipie shosh, nitumie shosh chakula. Niko na mtoto, anafaa kule, mimi mwenyewe pia nafaa nilipe nyumba, inafaa nikule. Kwa hiyo 3000. That's why nikaachana naye, nikajaribu business ikagwama. kajiingiza kwa sexual worker.
This evening, Vaona, and first of all, asante sana kwa kutuelezea kuhusu yenye umepitia, na kweli ni mambo mazito sana. We have a lot of stakeholders here, and eventually I'll be asking them, what do we need to do to end teen pregnancies and HIV infections amongst young people? But kwanza ningependa kusikia perspective yako. Wewe maoni yako ni gani? Hii mambo ya teen pregnancies na HIV infections, how do we end them?
Actually, mambo na early pregnancy, kitu ya kwanza inachangia ni orphan. Mtu background. Hauna madhe, hauna fathe, unaishi na shoshi mwenye hayuko well off. Poverty,
shida number one.
Yeah, poverty. Actually, number 2, school fees, education. Education maybe ndio hauna wazazi. Hakuna mwenye atakulipia school fees. Mostly, maybe mtu anaweza sema, what about maybe uncles, aunties? Nowadays, mtu anaangalia familia yake. Mtu akisha kufa ni hivyo. Mtu atakuja kwa matanga aseme, huyu mtoto mimi nitasimama naye hadi venye atasoma, but while venye matanga itaisha mtu ameenda hivyo, imeisha hivyo. Yeah.
Wow, okay, very, very insightful, and I'm sure others in the audience watachangia tukiendelea kuongea. But Pastor, thanks also so much for joining us, and a lot of people talk about how faith-based leaders need to be more involved in this conversation. But first, before we talk about the institution that you're a part of, what's your personal story?
Sorry?
Before we talk about the institution that you're ambassador for, what's your personal story as we count down to World AIDS Day?
Yes, I want to give my personal story. Me personally, I'm positive. I came to realize about my status 2013. My wife was very sick. I took her to different hospitals, and when she was admitted in an hospital, I had some sore throat in my mouth. I decided to go also me and look for medication. So the doctor asked me a question whether I've ever been tested of HIV. I said no. So when I went to VCT, I was positive. But that same week, my wife died. We had only one child, a daughter, actually whom I believe was born positive. And 1 month later, she died. So I was left alone. And I always say, if we knew our status before, my family could be alive. But you know, I was a pastor, so according to me, sikuwa nafikiria kama HIV inaweza kuwa in a house of a religious leader. So when I heard about testing, issue about testing, I was not concerned about those things. But at the end of the day, I came to realize it was in my house, and because of ignorance, I lost my family. So in that quote, I can advise my fellow religious leaders, it is good to take a lead in testing and also getting the right information about HIV.
You're actually taking me to my next question, because I wanted to hear from you. And first of all, let me thank you so much for being bold enough to share your story with Kenyans. And I'm sure many will learn a lot from you. Do you think the faith sector is doing enough? When you look at what you've gone through, are they doing enough to tackle HIV infection and teen pregnancy?
At the moment, I can say they are doing a bit. It's not like before. Because right now, through our organization INRELA, which stands for International Religious Leaders Living Positively, Infected or Affected by HIV, we have been building capacity on religious leaders, talking to them, engage them, to be open and talk about the issues of HIV in their congregation, and they use the available platforms so that actually people will not lose their life because of ignorance. It happened to me.
Okay, thank you for that. And I'll talk a bit about that, because a lot of people say the faith-based sector can do so much more. to help in this fight. But Dr. Geshuki, also thanks for hosting us as Nakuru County. We are in your county today, and a big day tomorrow as the world marks World AIDS Day in Kenya being marked here in Nakuru County. Now, for me, I'd like to hear from you in terms of what policy measures should have county governments put in place, and maybe what more can they do to ensure that they can ensure the safety of our young girls, because the numbers show that teen pregnancies is something that Kenya doesn't have figured out just yet. There are other African countries that are doing a lot better than we are.
Thank you very much. Certainly, safety of our girls is a very huge problem, and it is multifaceted. It has many faces, which require to be looked at from all sides, socially, religious, government, and everybody else. And also the national government in terms of security of places where we are at home or in the streets and everywhere. As per your question about safety in counties, in the Nakuru County, the Department of Youth, Gender, Culture and Sports has formulated a policy on gender and development. And from that policy, we have worked a bill on gender and equality, which is in the county assembly and has had the first reading. So it is indeed true that we are aware of this problem, and it is here in our county. And we want to look at it now from the county side in conjunction with the other prayers so that we can be able to address it.
What should be the focus tomorrow? All attention will be on Nakuru County, of course, with World AIDS Day being marked here. But should the focus be on more special programs? Should the focus be on more education and sensitization? From where you sit as CEC Health, where do you feel are the gaps?
Our biggest problem actually is sensitization. To make aware, especially our young girls, on sexuality, that is reproductive health matters, and issues to do with HIV transmission, and also gender-based violence to everyone who is a player in the society. And we would want to look at the national policy and also insist that we create more awareness. And then, of course, we look at the major drivers of these things and look at especially what she said, like poverty. A lot of research has shown that around that age for girls, menstrual hygiene plays a role, because maybe parents might not afford the dignity packs, that is the pads. And therefore the girls, they might get the food and housing, but the parents might not afford maybe that one. And therefore counties would want, like we are doing here in Nakuru, to invest and cushion money for procurement and distribution of those pads so that the girls who are in school can get them, so they don't have to look for alternatives somewhere. That is a huge step, and also we think it's a major, high-impact intervention.
Very practical interventions that we will talk about even as we continue with this conversation. I shortly will be crossing over to our front row here, where I want to gauge some of our other panelists. Remember, 22422 is the SMS line. The hashtag is Newsnight. We've had some very real stories from some of our guests here, and really grateful that they're able to express themselves on the same. And of course, we've had the county perspective as well. But what are the numbers this evening, and why should Kenyans be paying attention? Dr. Ruth Masha, I want to hear your voice on this as the CEO of the National AIDS Control Council. We are getting reports that we have new high infections as well as teen pregnancies amongst young people. Where does the situation leave us? Where are we as a country this evening on the eve of World AIDS Day?
Thank you very much, Maura. First of all, let me say that as a country, we've done quite some remarkable job. If we compare where we are today and where we were 2013, we have been able overall to reduce the number of HIV infection by 68%, actually 68.5%. And in addition to that, we've been able to increase the number of people living with HIV on treatment. But the challenge is that the progress is not fast enough. And we also missed the target that we set. We had set that we were going to reduce new HIV infections by at least 75% by the year 2020. And this is in line with Vision 2030. And that would give us a pathway towards thinking of ending AIDS by 2030. So we have currently missed that target. And when we look at the challenge is that majority of the new HIV infections, actually around 75% of all the new HIV infections, are among younger people, younger adults, from the age of 34 going downwards. And that really presents a challenge. And if you go again and look at another cohort of where she's brought out the issue of especially girls 15 to 24, we get another proportion of around 42% of adult infection coming from that area. She did talk about some of the challenges, such as sex work, which she says that she has gone and she's in sex work because of her previous circumstances, and she finds herself today doing sex work and in addition also living with HIV. And that's really a real challenge, because in our data we know that sex workers are almost 5 times more likely to get HIV than people in the general population. And so in a nutshell, we've done well, but not good enough to celebrate. And that the fact that we have young people getting HIV is a challenge, because then what it means is that it's going to be very difficult for us to end this epidemic. We have people we are putting on treatment, but the numbers of new infections are outweighing the ones we are putting on treatment. It's the analogy of when you say you are actually mopping the floor when the tap is running.
Well, I think that example really explains where we are. Do you think we are leaving young people out of a conversation around a pandemic, around a disease that's really affecting them? Should we have more involvement of young people? Is that one possible solution?
My perspective and that perspective of the council is that where we are at now, we have to do things different. And the question around the young people and their role in putting their voices or being heard of what actually they need. You cannot treat a young person today the way we treated a young person in the 1980s. So we cannot sit all of us and discuss what a young person needs if they are not on the table. So I think it is true that if we don't sit with her to hear her experiences, we don't sit with her to tell us what is the best way for us to address the challenges that she's currently going through, then all our interventions are going to be interventions that we think from a conference or from a boardroom. So I think there has to be a space for young people to sit with us, to be given the chance to have that agency to say, these are the things that are required. And one of the elements that we must confront as a society is the politics around what education our children need about reproductive health, about the life skills they need, and even about sex education. I think the discussion has been focusing on, are they old enough, rather than what do they need at the age where they are. Because when we start saying, are they old enough to learn, then we miss the point of what they need, and that is why they need to be at the center of the discussion. Okay,
thank you for that. And Fiona, I'll give you a chance to respond. I'm sure you're hearing a lot of this, but I believe we have 2 microphones in our audience here, and I want to give maybe 2 people to give a chance to respond to what has been said so far and give their view. Sir, you have the microphone. I can give you the first chance just to give your thoughts on this topic today. Start by introducing yourself to us.
Okay, I'm Reverend James Kasomo from Nakuru Pastors Fellowship. My response from what I'm getting, or from what we are hearing, because this thing is affecting most of our youths. It is high time we, the parents, we make friendship with our children, so that we can be sharing some of these things one-on-one, as father and son, mother and daughter, without covering things.
So you feel a lot of the work needs to be done in the home?
Yes, it has to start from home.
Okay.
It has to start from home.
Okay, thank you, Reverend, for that. I think we have somebody who wants to please begin by introducing yourself and then state your point.
My name is Patricia Asero Cheng. I'm the chairperson of the International Community of Women Living with HIV Kenya, that is ICWK. My take is that you've told us about the data. Dr. Masha has told us about the targets. But one thing that we have to stop doing is putting our heads in the sand. Because when we are told that kids as little as 10 years to 15 are pregnant and are coming to a health facility for antenatal care, then we should be asking ourselves questions that what is happening? Who made those kids pregnant? And what are we doing as communities? What are we doing as law enforcers? Who is not doing their part? Is it that the parents? Is it the community? What exactly is going on? Because initially when I was growing up, a child belonged to everybody. If I made a mistake, a neighbor would cane me and bring me back home. So what is it that we are not doing right? So that is one component. The other component we need is age-appropriate sexuality education. We are not saying we teach children about sex, but we are saying we teach children about themselves. Who are they? What is happening to them? What is happening to their hormones? They need to know that to be able to take care of themselves. The last but not least is about the legal issue. What does the law say about a child who is 18 years and below? Is this a person who can give consent to sex? Because if they are pregnant, that means they're having sex. And that means that sex was unprotected, which means HIV could be there, which means STI could be there, which means there's also lack of information. What gaps are there in our programming that is also causing this? We should look at it holistically.
Okay, 3 points that you've raised, very strong ones. Okay, someone's raised their hand just behind you. I need to get some responses here, but maybe we just get 1 point, and then I allow each of my panelists up front to say something to that. Please begin by introducing yourself.
Okay. Thank you very much. I'm Philip Nyakwana. I work at Movement of Men Against AIDS in Kenya, and I work with men and boys. So I want to maybe raise 2 issues. One, I think at some point, and maybe just from what Patricia said, we used to have social safety nets. This social safety net used to take care of our children at that level. Then came in the issue of the legal issues, the children's right, and then came the issue of school, came the issues of religion and all those issues. Then the children were left in a dilemma. Parents are also working with their career, so children were pushed to school. Teachers do not know how to deal with them. They are pushed to churches. Those pastors and religious institutions do not know how to deal with them. When they get back to the family, parents are also busy building their career. They don't know how to deal with them. So children are left at a point when they are confused. Then here we come again with our intervention to address some of these issues. We are addressing these issues at the top, but not looking at the root cause. Then at the point of intervention, there's also some level of discrimination. We are talking about girl child. Where are the boys who make them pregnant? Because you will have them, you will empower them, you will give them all that you give them, but men are busy planning how to make them pregnant again. You see, so we need to embrace what is called a family-centered approach to our programming. Because at times you can also take them, empower them, train them, but they get back to a family or a home where people still have that traditional mindset. You are not helping this child. They are still getting back to an environment which is toxic, so we can be talking to them, but when they get back there, who supports them at that level if we want to achieve? So we must embrace family-centered approach to this programming, and we must bring everybody concerned on board. Otherwise, we might not achieve much. Thank you.
Thank you. Two good points there. And also, Patricia, thank you for that. Doc, I'll give you a chance to respond to some of that. Okay. It needs to be short. Go ahead. We have another panel that we need to also bring on the table.
Thank you very much. My name is Maureen Murenga. I'm the Executive Director for Lean On Me Foundation. We work with teenage mothers living with HIV. Mm-hmm. And I'll just say that being a teenager is hard. Being a pregnant teenager is hard. It's even worse when you're HIV positive. And some of I look at these things, they're all preventable. GBV is preventable, HIV is preventable, and teenage motherhood is also preventable. But when we hear about the statistics, and more so when we've had these conversations, we heard that it happened a lot during the time when kids were out of school and during the COVID season. So are we trying to say that our homes are unsafe for these girls? And so like Philip said, we try so much to address these things, to address the symptoms. We are not getting to the root causes. If the homes are unsafe enough for the girls to stay safe, What do we need to make our homes safer? And then we also try to prevent what is coming in one way. When we are talking about behavior, we focus on behavior. But we cannot look at the triple epidemic in a singular way. We need to address the behavioral factors. We also need to look at the structural factors. What are the barriers? When we talk about introducing age-appropriate sexuality education to teach children what they are, what their bodies are, what they are for and what they are not for, we get a lot of pushback because someone understands it differently. So I think the structures we have, which are our community gatekeepers, our religious leaders, and other political people, we need to really have a common language so that we are speaking in the same language and supporting. And then we have biomedical. We have not given the young people enough information to tell them that if you are coerced to have sex or if you are raped, there's services you can receive to prevent HIV, to prevent the pregnancy. So we need to really be very open, give information that is understandable, and also as a country have a focus, have a position. We don't want to be divided when one faction is saying we need to talk about these things, another faction is saying those things are not appropriate for children. So I think we need to really strike a balance. And we treat this as an emergency, as an epidemic that needs to be addressed from the root. Thank you.
Thank you, Maureen, for that. And indeed, the conversation that we're having today should be treated as an emergency. If you listen to the numbers, if you listen to the case studies that are being shared here today, we really do have a problem. Let me mention some of your feedback. Dear Odwori, you're asking, how has COVID-19 affected the war on HIV? Some of my guests will respond to that. Fantas Mutiga, you're tuning in from Embu. You say, I'm a biology teacher by profession. I feel that sex education should be included in our curriculum. Well, some would say that's a controversial angle. I'm sure some of my guests will speak to that. A proper campaign about HIV needs to be done. Today, students don't even know the ways of preventing HIV spread. That's a fantastic Mutiga. Let me get some final thoughts from each of my panelists here, because there's another panel I need to bring in. There are so many facets and angles to this HIV conversation that we want you to be aware of this evening. Vaiona, first, let me thank you once again. You've really helped us to walk through what's a very sensitive topic, the stigma of one declaring your status and the stigma of declaring even the line of work that you feel you have to do to be able to survive. What sort of support would you ask that society gave you or anyone else going through what you're going through today? Kwa ufupi, what do you say that is?
Okay, ile support yenye tunahitaji, mzazi inafaa ku close na mtoto wake. Kama mimi sasa niko HIV positive, but sina mtu mwenye nielezea juu hata ukielezea friend anakutoroka. Like hata uwezi kwa plot uko comfortable, uwezi ambia mtu anaona utamkiza mtoto wangu ugonjwa ama utamkiza mtoto wangu kwanza kutembea. Sasa mzazi ako close na msichana yake, hata akipata kosa jaribu kuongea na yeye ujue nini imefanyika.
Na pia hebu tuelezee kama ungepata njia ya kufanya biashara ingine. Maybe wakati ulikuwa sasa umemaliza shule na unatafuta njia ya kuchunga mtoto, kumlisha na shosho pia. Kama ungepata njia nyingine ya kufanya maybe biashara, ungeifanya?
Yeah, ningeifanya.
Ungeifanya. So shida tu ni some sort of assistance, usaidizi ndio uendelee na maisha yako.
Yeah, tena unajua sikumaliza 4th, nile drop out form 2 because of school fees. Sasa unaona kazi kupata ni ngumu, idea yenyewe nimeprocess kani imechelewa. Unaona, hata ilifika point nilikuwa nataka kwenda Saudia but vitu zilirun out siku manage. Juu kazi hakuna, siwezi pata kazi. Alafu sasa hizi connection. Vitu mingi zinataka connection na connection yenyewe tena kuipata ndio hiyo ni inawezekana.
So kwa sasa unasema umeamua kuishi hivi kwa sababu hauna option nyingine.
Yeah, but nikipata mtu anaweza chip in ni rahisi sana, nitaacha ni concentrate tu kujua. Pia mimi ni mzazi na maisha yenyewe mimi naishi, sitaki mtoto wangu apitie the same situation. Na jaribuani akae maisha mengine tofauti. Na ile age yenye yako sasa nataka at least hata kifika kitu 10, unajua ni mtoto atajua moves zangu, maybe majirani, watoto wenzake wanamwambia, unajua mama kana anafanya kitu hii na hii na hii. Unataita mpea ile mentality ya ku concentrate kwa scholarship yake. So nataka hata before afike hiyo time, naomba tu Mungu achip in, at least ni mlenje yenye mzazi yeyote tu anaweza feel kulea mtoto wake.
Wow, asante. Thank you for sharing that with us. Pastor, you're hearing, you're nodding your head, you agree. Stigma today, and I'm told there's different types of stigma. When you are living with HIV, there's stigma that how you view yourself. There's a stigma now from others as well. Talk to me about what you go through as you move around, sharing your story, trying to inspire and help others and give them hope.
There's a lot of stigma, especially for religious leaders who are living with HIV, because sometimes people see HIV as a moral issue, not a virus. So when I go sharing on my story, in every place I share my story, I know today there are people who do not know my status and they have known my status. So I expect some sort of stigma. When I meet them, it will not be like before. So I can say there is a lot of stigma even in our congregations, because when people knew my status during that time, I have even members of the church who left the church, they say they will not be, they stopped giving, offering in that church. Even there is a day when somebody, because I was living in the church, alitupa mafuta kwa nyumba ambayo nilikuwa ninaishi na akasema leo I'll kill you.
Oh no.
So there is a lot of stigma, especially for we religious leaders. And I know there are many religious leaders who are living HIV positive, but they are just quiet. They die quietly. They don't go for medication because they are fearing this kind of stigma. But
why do you think faith-based institutions and leaders who lead such institutions are so, I guess, averse to change? We know that the world is very different from how it was 10, 15, 20 years ago. What do you think is the main challenge that makes it maybe difficult for many more faith leaders like yourself to come to such platforms and have such conversations?
I think it's because of their faith. Faith, you know, in Kenya we have freedom of worship and every organization has their own doctrines. And because of that, there are some religious leaders ambao naweza sema actually kile kinawasababisha kuja kwa platform kama hizi. Unajua kuna ule utakatifu, mtu anasikia mimi ni mtakatifu, vitu kama hizi ni vitu chafu, sifai kujiinvolve na hizi vitu. But this is what is in the society, even in our congregations.
Sasa wewe ulipata nguvu aje kuongea hii maneno kwa TV, in public? Nini ilikupea ile?
Kile kilinipea nguvu, nimekuambia nilipoteza familia yangu. Na ninajua kuna watu ambao they are like me. Niliamua kudisclose my status, nisaidie yule ambao nitasaidia. Actually ilikuwa tu ni disclose, nisaidie wengine wasipitie yale mambo ambao nimeyapitia. Na actually nilifanya hivyo ndio ikiwa kuna any religious leader ambaye amejipata ni positive, asiishi peke yake, anaweza kuja kulalia hii kifua, nimsaidie na tuendelee na maisha.
Nadhani mnafaa kumpigia makofi. I think that's a very strong point that he has brought out. Pastor, thank you so much for that. Dr. Gishuki, tomorrow Nakuru enters a new status. The journey to city status is closer and closer by the day. The term city, cosmopolitan, a lot of people will continue to flock to Nakuru looking for opportunities. And when you have such a mix of human beings, poverty, sometimes for some who came to Nakuru expecting one thing, find things are not working, have to find a way to survive. How are you preparing the county for the sort of possibly health challenges that may be experienced with the benefits that come with the city status? Are those thoughts that you are having? More people in Nakuru might mean we need more healthcare, we need more sensitization on what they need to be aware of.
I agree with you that recently we've had a lot of people coming to Nakuru, especially because Nakuru, as you might be aware, is the second biggest economy, and when you are within Nakuru, you are within 200 kilometers of every major town except Mombasa. And there are a lot of industries here in agriculture, tourism, energy generation, trade, and transport, and many other sectors. And therefore, all illnesses and all medical problems move with people. And therefore, we are prepared for that as a county, but not so well because, also health runs on money. This county gives about 6 billion of its budget to health. And specifically for HIV, I still strongly believe that we should put more money in health promotion, that is sensitizing our people and making them aware of HIV and sexually transmitted diseases like we've always done, and also prevention, because it makes more sense that way. But of course, for the few who go to the other side, we should also be able to invest properly to take care of them in terms of infrastructure, the human resource, service delivery systems, health products and technologies, that is the drugs and the diagnostics, and also monitoring and evaluation of the programs that we do so that we run an efficient program. Because we know from experience, I'm a doctor and I've been in charge of HIV in Eastern Province, so I know HIV very well, that if we take good care of these people, they can be very productive in society, and they'll live just like the rest of us, and life will be good. And therefore, the emphasis should be health promotion and prevention. And that also brings in that other aspect of teenage pregnancies. It is indeed a problem. In some parts of this county, 18% of girls get pregnant. That is not what we would want to hear, because we know the repercussions from the way we curtail their future lives professionally, academically, and otherwise. So Nakuru as a county, we've invested properly in terms of healthcare deliveries in all levels, from the community level, dispensaries, health centers, so that an individual who requires maybe HIV testing and counseling can go to a dispensary. Okay. Will be referred for treatment and any other thing, care and monitoring. And I think that is a good system, but it is very costly, and we require as a country to put in more resources so that we are able to take care of those clients.
Thank you for giving us that county perspective. We are eating into our second panel, but Dr. Marsha, let me give you 1 minute. Anything that you want to respond to? Some very strong points have come out from this panel right now. Let me give you a minute just to weigh in as well.
Thank you very much, Maura. I think one of the most critical elements that is coming from this conversation is that there are those individual things somebody can do, but it's something we must do as a society as a whole. If you listen to the stories, for example, education is actually a right. It's an equalizer. It's what can get somebody from poverty to be sitting next to you today if they came from a poor background. But when we have children dropping off school, like the story she's sharing with us, it means that if we had means and we had made sure she was in school, then staying in school would have actually helped her not go through what she's gone through. So for me, the learning lesson is that as a society, we must address the things that individuals are not able to address. Sexual, gender-based violence is not an individual issue. It's actually a society issue. So you have to make sure that while we are tackling what you're saying, behavior change, what you're saying somebody can do, we also tackle what the other things that within the environment that then prevent that person from being able to also remain HIV-free if they're negative. The other element that comes out very strongly is that, and also with the emergence of COVID-19, is that we must really address stigma. And I want to thank the members of this panel that have really come out strongly, especially the pastor here who is saying about stigma. Because stigma is actually the real challenge. If there was no stigma today, anybody would walk into any facility, know their HIV status, and they get treatment. He actually tells us that if he had never delayed testing, today would be having his wife with him and his child. And so delay in testing or diagnosis of HIV is actually an element of stigma that also sometimes lack of knowledge, but stigma is very key because by the time you're making the decision, you're also thinking about what if it is positive? Who is going to be with me in this journey? And that is the most important thing. So I think as we celebrate the World AIDS Day, we also want to congratulate people like the pastor here and many other people who over the years volunteered their stories to share with many of us so that we can take action. I think for me, we owe them, because it is through their stories that most of us have been educated, those who have not been able to get information elsewhere. And it is why, the reason why, even as we celebrate the World AIDS Day, the first thing the day was set aside to do was actually to appreciate the role that people living with HIV have played, even for those who do not think it is their problem. Secondly, is that I think all of us here, you know somebody you've lost due to AIDS-related illnesses. So we do remember them. And we remember them to allow us to think about the way we treat people today. And that is for that reason that we then recommit ourselves, so that as individuals, as a country, as government, as any partner, that we can be able to do things differently. I don't think that 37 years down the road, we could be talking about stigma the same way we are talking about it today. Thank you.
Thank you, Dr. Masha, for that. And we'll be hearing more from her on the other side of this break. Too many tweets, can't read all of them. Omolo Roger Shamar, you say, one of the contributing factors for teen pregnancies is lack of access to adolescent-friendly, gender-responsive information and services. You're using the hashtag NEWSNIGHT. Keep using that so I can track this conversation. Someone else here says there's a need for economic interventions, especially to end teen pregnancies. We need to engage young men, not just focus on girls. We need to treat that gap, okay? And Jerry Otho, you asking, what's the role of international bodies in the fight against HIV? Elizabeth Omondi is thanking us for being inclusive by having a youth as a panelist, and also for having a sign language interpreter to make sure the views reach all Kenyans. Thank you so much for that. At this time, I'm going to allow my panelists to leave the stage. We'll take a short break. When we come back, we're going to get deeper into the conversation. This has been Vayona Juma, teen mother living with HIV. Thank you so much for sharing your experiences with us. We've also had Pastor Mulinge Mutuse, who's an ambassador for an institution that really champions for religious leaders to get more involved in having this conversation around HIV and how they can sensitize their congregation on the same. Thank you, Pastor. Together with Dr. Kariuki Gishuki, CEC Health, Nakuru County, our host today. And of course, tomorrow, all roads will be leading to Nakuru as the world marks World AIDS Day. On the other side, when we come back, we'll have Joyce Adhiambo, a community champion for HIV and STIs, also a researcher and also a sex worker. She wants to share her story here on the program. We'll be joined by Professor Lukoya Twoli. He's the chair of the Mathare Hospital Board. It's a high-level panel. We'll have Dr. Rose Wafula, head NASCOP. Also hearing from her, Antonio Odhiambo, a social behavior change expert, and Angeline Separo, who's the chair of the National AIDS Control Council. It's a conversation you don't want to miss. We've got a lot to talk about, but we'll make sure we do it in as little time as possible to get as much as we can out of this conversation. You're watching NEWSNIGHT live from county number 32. We'll be right back after this short break.